folks, we're going to get started in just a minute or so. Welcome. I've got 6 o'clock. Perhaps we should give a few more minutes for folks to join. I do see Alex here from Lollipop. Thanks for joining, Alex. I know it's after 6 o'clock. We're just waiting for a few more people to log in. And it seems some people are still trying to register. I've gotten a couple texts, so I'm going to give it another minute or two unless you want to start.
If people are in the process, we can do that. And what I found as well is when people know that the presentation is going to be recording, they might watch it afterwards. Like, we've done these presentations pre-COVID in person and only had, maybe 30 or 40 people there, but then 700 people online, so maybe people will are just saying, "Oh, I can't make that time, but I'll watch the recording later," which is fine. We welcome everybody, whether you're here live or listening to the recording.
Okay. Well, if you're ready, then let's get started.
Great.
So welcome everyone again. This is another one of the forums that we're trying to lead at or bring to you from Animal Services. We're fortunate to have a guest speaker with us today, a colleague and renowned expert in animal welfare programming and operations. So I'm not going to be speaking most of tonight, but am going to turn the floor over here to our guest. It's Dr. Sarah Pisano, who's joining me on screen right now. Dr. Pisano has a master's degree from Columbia University and a doctorate in veterinary medicine from Cornell. She completed a internship at Animal Medical Center in New York City, then served as an associate vet at the North Shore Animal League before joining the Humane Society of Broward County in Florida. as the director of their veterinary services. Dr. Pisano was later appointed as the director of Miami-Dade Animal Services. So she took those experiences and leadership positions, both in private and public shelters as program directors, developing the Target Zero to transform high euthanasia public shelters. And from there, she created Team Shelter USA, which is who she's representing today. Through Team Shelter USA, she visits animal shelters, public and private, across the country. She's completed over 115 shelter and community assessments, helping organizations end euthanasia as population control. She's the assessment team leader for Maddie's Million Pet Challenge. So through that, she coaches students and veterinarians from across the country to learn this invaluable approach. She's the author of a book called The Best Practice Playbook for Animal Shelters that was published in April 2019, and I read it in May 2019. Dr. Pisano currently oversees the assessment and mentorship program at Maddie's Shelter Medicine program at the University of Florida, where she's also a courtesy faculty member. She's part of the Million Cat Challenge and now the Million Pet Challenge, and is a trainer for the Open Door Veterinary Collective. So without further ado, I'm going to turn it over to Dr. Pisano. We will have time for questions at the end, but any questions you want to pose during the presentation, just enter into the chat. Thanks.
Thank you so much, Chris. And don't forget, proud undergraduate, graduate of the State University of New York at Oswego. Just had my 36th or 7th reunion or something like that, but just means I'm really old. Oh, okay. I need to share my screen. It says it's disabled participant sharing of the screen. Great, thank you. All right, now you've seen my messy desktop. I want to also introduce my colleague Cameron Moore behind the scenes. She'll be answering your chat questions. If you do have questions, you can put them in the chat, but I want to encourage you to try to listen to the presentation, because over the years, Cameron and I have tried to work in every answer to the questions that you're going to ask. So I think it might be a better learning experience for you, but Cameron has tons of experience. She is with the University of Florida right now, part of Maddie's Million Pet Challenge, was part of the Million Cat Challenge team. She has her own nonprofit cat rescue and worked at First Coast No More Homeless Pets. So she has a plethora of great experience. And if you have burning questions, you can go ahead and put them in the chat. Cameron may say we're going to wait to answer those, or she may answer your question. But like Chris said, and thank you so much for the invitation, Chris, to do this presentation. I have, and mostly Cameron and I have done assessments in all these light blue states. So now I need to make New York light blue, and I need to make Wyoming light blue, because I'm going to Wyoming on Monday. So it's going to be more than 25 states, but we have been in large shelters, intake of 30,000 and 40,000. And we have been in urban or rural shelters with intakes in the hundreds or under 1,000. Very, very rural. We've been in warm climates, cold climates, as you can see. And what we learned from all of this is empirically, every single animal welfare organization faces the same challenge, maybe just to varying degrees. But the beauty of what I'm going to tell you tonight is that the solutions are universal. Our recommendations are not mine. I didn't make them up. Cameron didn't make them up. Maddie's didn't make them up. This is really all of the experts in animal welfare over the years have put together these resources. The first one is the Association of Shelter Veterinarians Guidelines for Standards of Care in Animal Shelters. And at the end of this presentation, I have a slide with all the websites of what I'm talking about, and you will have this presentation. So you'll have those as reference if you wanted to read more. Fear-free is a movement I am so grateful to be a part of. We now have fear-free sheltering so that there's an awareness finally of what animals are facing when they're entering the unnatural environment of the shelter and what we can do to make it more comfortable for them. My number one fear-free tip, keep them the heck out of the shelter. Keep them in with their loving families, keep them in, or put them in a foster home. And we're going to talk about that. The assessment, the consults that were done at Rochester Animal Services and at Lollipop Farm were part of Maddie's Million Pet Challenge. So they were provided pro bono, hashtag thanks to Maddie's, had to get that in there. And also, if you don't know about the Human Animal Support Services, I'm going to say a few words about that. Chris alluded to the playbook. So what was happening as Cameron and I were doing all of these assessments, guess what? We were writing the same recommendations over and over. And I thought, this is crazy. We're saying the same thing. Why don't I just publish a book? So that's what I did. So the book is available on Amazon. You can get it in a paper copy. You can get a Kindle, or you can get it on Apple. So there's ebook opportunities as well. But back in the spring of 2020, none of us knew what was going to happen. In animal welfare, we were like deers in the headlights because we didn't know. Remember, is COVID going to be contagious? To dogs, between dogs? Can cats give people COVID? Like, we didn't know any of these answers. Our staff are getting sick and they're out. How do we deal with that? What do we do? How do we provide services? So we all from on the national circuit got on these calls, and many, many shelters from around the country every single week, which turned into twice a week. And just to brainstorm and get together and say, how are we going to handle this? And what are we going to do? And what should we tell shelters? And we have colleagues that work directly with the CDC on these recommendations. This turned into the Human Animal Support Services, which for short is HAS. That website is right there. It's also at the end. But this is sincerely, it's not a new organization that's saying some crazy new thing. It's all the national animal welfare experts saying, here's all the best practices in one place. So lots of amazing information. I'm going to talk more about what we consider best practices, but wanted to just acknowledge the generosity of Maddie's, not just for us to do consults, but for the Open Door Veterinary Collective that I'll tell you about, and the University of California. Our very first consult was in Waco, Texas, back in the end of 2012. And you can see these two bars. This is outcome for pets. So the green is live outcome and the blue is euthanasia. And before those years, it was the same thing over and over. So every year we wished it was different, but we never did anything differently. And we euthanized the same number of animals. We had the same patterns. When Waco out of the gate just implemented a few of these strategies, right away you can see the decrease in intake, the decrease in euthanasia. And now it's, we even stopped tracking because they were doing so great for years. But this is what we want to see. This is a city at the time that had a poverty rate of 30%. So when we started, they said, oh, thanks, but you're probably not going to be able to help us because we're really poor. And we said, well, try these strategies because they make sense. They're cost savings over time, et cetera, and they're really effective. And they trusted us enough to try, and it worked. And that's because what we're recommending works everywhere. But the biggest challenge is between our ears. And I'm guilty of this, and you're guilty of this. This is the human brain. We automatically trigger to the negative and amplify the negative. And I know I work really hard on this every single day to try to ask myself, wait a minute, is that the reality? Or is that just because I'm in this field and I've seen that I'm, in this particular situation a lot. So I might have a skewed vision of the global issue of whatever I'm thinking about. So remember that we all have our own upbringing, our certain environment, what we learned, even as children, as adults, what we were exposed to. That's our own microcosm. And the not so secret, that should not be secret, is when we respect our own microcosm and everybody else's, that's when the communication happens. That's when we can really all achieve the goals that we want in animal welfare, which is not just saving animals. We don't want animals to enter the shelter to begin with. We don't want abuse and neglect, right? So all of these things together can add up to a really system, an animal welfare system in a community that's set up for success instead of failure. And we are famous in animal welfare, public and private shelters. We don't have enough. Well, we need a bigger shelter. We need more staff. We need more money. Instead of saying, whoa, 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 maybe if we use our resources more strategically, maybe if we ask people for help and stop trying to be everything to everyone, and I know I do it because that's who we are in animal welfare. We try to do everything for everybody. I want everyone to just take a step back and think about that, because we are one person or one organization. We need to cast this net and say, what can everybody do to help a little bit with all of these puzzle pieces? So it's really about thinking about what we do have and how we can use our resources strategically. Everybody triggers to money, but it's much more than money. It's our shelter space, how we're using it, how we're what is our staff doing every day, every minute of every day? What are our volunteers doing? Are we trying to work with other organizations in and out of animal welfare? We also feel like we're a little out of control, even though we are called animal control. We feel like we don't have any, but in fact, we do have more control over what happens in our shelters than we don't, right? So this is just a little bit of a schematic to bring that point home. And the traditional system, again, is something that we've seen in so many shelters that are struggling. And again, high poverty rates, just like Waco, just like the city of Rochester. We know you have a high poverty rate as well. But that's why these programs are even more important, because we know that poverty is and socioeconomically disadvantaged pet owners are the ones that usually make up most of the shelter population. But this flawed system means that we let everybody come in because we have to be everything to everybody. And then we have all these self-imposed barriers to live outcomes. So this is what I want everybody to think about. I'm really proud of Rochester Animal Services because there are a lot of shelters struggling with long lengths of stay right now. The industry standard is, listen, try to get them out, before 14 days, because that's when we see a lot of mental anguish in animals. And your shelter in the city has a 7 or 8 day length of stay. That's phenomenal. And that's important because when animals stay in a shelter for a length of time, it's stressful for them. We have more animals coming in than getting out. That means we're going to have overcrowding, more disease, more medical bills, more decreased life saving, because rescues maybe can't take animals with infectious diseases, and people are less likely to adopt a pet that is sick. And now it's just a reactive waste of resources that I could have prevented if I was at the front end of that. And that's what I want to talk about tonight. And most importantly, when a shelter is operating over capacity for care, they lose the ability to provide that fear-free environment. And that's stressful, not just for the pets, but for all of us, for staff, for advocates, for rescues, for volunteers, for leadership. So what we want to think about is triage. So what can we do? How can we help these animals in ways other than a shelter intake? And this is what we asked ourselves when we all got together at the beginning of the pandemic and HOS was formed. What could we do differently? Well, we can ask our community who was calling or bringing in pets if they could possibly foster during this time. So many people were home, right? Because of the pandemic and quarantine periods. And that exploded, and it really helped a lot of shelters gain some community support. So let's see who we can help in other ways leaving admissions to the ones that we don't have alternatives, or maybe they're true enforcement cases, victims of cruelty, neglect, etc., and then removing those barriers to live outcome. And if I forget to say it, I'm going to tell you why that is so important. Shelters need and rescues need to know that less than 40% of the pets in the United States are adopted in shelters or rescue groups. And so that means most people are getting their pets on their own, and they're living large and having a great life without us. So we don't have to be the adoption police or the placement police. The basis for setting this whole system up for success in a community is public policy. And that goes whether you're a public shelter or a private shelter, because a private shelter has to abide by ordinances as well, especially if they're taking in pets and having to, especially if they're taking in stray pets. And so we want our officers to focus on public and animal safety and make sure that all our ordinances, whether it's county or city, if they're separate, that they are certainly in line with state statute, but that they're all in line with the best practices that we know work. So that means no breed restrictions, no pet limits. Sometimes people think if we have pet limits, we're going to prevent hoarding. It's not correlated. We know that we don't need a stray hold on cats, and cats have their own special category I'm going to talk about. And puppies. Puppies are another very vulnerable group. We don't want to hold them in the shelter exposed to infectious disease to no fault of anybody. They're just animals that come into the shelter already exposed or sick, or they get sick in the shelter because of that. And then certainly we want to see an incentive when somebody comes to pick up their pets. We want to give an incentive, meaning I want it to be cheaper for them to sterilize, vaccinate, and microchip their pet, and if there's licensing in the community, versus giving them all these citations and fines. And then of course we look for any other unnecessary barriers to life saving. And in your area, and in this is a great example in Santa Cruz. I know you're all doing such great work called discretionary enforcement, and seeing first, how can we help people? Because we now know that those punitive cases often were simply a lack of access to care. And in those underserved areas, that's really, really common, that it's not true neglect or abuse. It's just they did want help for their pet. They just didn't have access to it. And when we engage the community of people, even if people in need, we can then turn those high intake areas into low intake areas. And again, our officers can focus on true public and animal safety. The next part is, and I think about this like a globe, I want to think from the outside in. So the very outside is public policy, and the next level is community programs. We know that proactive programs directly affect and benefit shelter intake, meaning it decreases intake, and targeted spay neuter is one of the most important ways, because and then those animals are not born. It is extremely important to target subsidized spay neuter now more than ever, because our veterinary clinics are struggling, spay neuter clinics are struggling to find vets. Capacity for spay neuter is definitely an issue, but it is always a great investment for municipal shelters because it will decrease intake. And I say municipal and not general private, although it's great for private as well, is because again, we know that in private shelters, most of the time they have the option of taking animals in or not. And this transition to triage admissions is sort of now just taking hold in the last several years, thank goodness. But we need to concentrate on the groups that are at risk if they enter the shelter. And so large breed dogs, if they enter the shelter, we know they're going to have a longer length of stay than a small breed dog. That goes without saying. Unsocialized community cats. People are not banging down the doors to adopt an unsocialized cat. Those cats want to be outside. They want to be mousers. They want to be rodent patrol, all of that. In Jacksonville, Florida, and this is where Cameron worked at the spay neuter clinic, this is a great graph that shows the direct inverse correlation between targeted spay neuter intake at the shelters, and euthanasia. So the green is targeted spay neuter. This purple is intake, and euthanasia is red. So you can see the more surgeries you do, the lower the intake, the lower the euthanasia. If you are a private shelter or you are a rescue group and you're saying, well, but how does that benefit us if we don't have to decrease intake? Well, think about it this way. You want to help pets in need. So if you can find ways to help pets in groups that maybe you can find other alternatives for them, you have more space, resources, etc., for those pets in need. Now, for those lower income pet owners, research is linked about 5 to 10 subsidized surgeries per 1,000 people in your community. And with the city of Rochester, you would want to go 10 per 1,000 because of the high poverty rate. You want to look at high intake areas, those large breed dogs, and then certainly community cats. But look at Waco. Remember, look at the Jacksonville graph. Like I said, direct inverse correlation, and look at the Waco graph. It's the same exact graph. The reason Huntsville looks different is because they didn't have a consistent high volume spay neuter clinic, and these flatline surgeries, about 2,000 a year, were done by a network of private practice veterinarians, but nonetheless, they decreased intake from over 10,000 and they're under 5,000 today. Access to care has been declared by the American Veterinary Association as the #1 crisis in animal welfare today. There was a very sad report. It's an Access to Care Coalition report from 2018. Cameron, if you could write that in the chat, please. Access to Care Coalition report 2018, because I don't believe I included that in the last slide. Those sobering statistics include 29 million pet owners who are on government assistance, 60% of American workers who live paycheck to paycheck, and even 20% of high income earners that could not come up with a $2,000 emergency veterinary bill and pay it off in a month. Those are sobering, very disturbing facts, but I can only imagine since the pandemic that it's even more dire, because that was 2019 and here we are in 2022. Years ago, now 5 or 6 years ago, 4 partners decided they wanted to make a difference with an access to care clinic and prove that you could have a for-profit model that was financially sustainable and profitable and enhanced access to care. So Open Door Veterinary Collective is our national training program. The hospitals were opened 4 and 5 years ago, one in Toledo, Ohio, and one in Asheville, North Carolina. They are both profitable. They are both netting the same as a private practice, and we know there's potential to do more. It's called the opendoorconsults.org is the website. And then we did a blog recently that's down there at the bottom of that slide that we published with Haas, that really explains everything about the model. And I would encourage all of you to read it, encourage your veterinarians to reach out to us. This can be a private practice. They could have been in practice for 50 years, a for-profit hospital, and they're like, we want to enhance our access to care. Let me find out what that's about. Or it could be a non-for-profit. It could be a clinic that's just starting out. So make sure you spread the word to your veterinarians or anybody interested in opening up a clinic, because this is a model that works and is sustainable. I strongly believe in it. So I am part of the team because of that. And I think it has to be the future of veterinary medicine. I want you to think about the clinic having to get paid. We have to have a job, right? So the clinic staff has to get paid. The veterinarian has to get paid. As nonprofits, we want to pay for everything all the time. That's not sustainable. This means that the clinic will get paid part by the client, maybe with payment plans over time, Or maybe there's other ways the client is going to help. Maybe it's a voucher from a nonprofit. Maybe it's a foundation grant for a heartworm treatment, what have you. So the clinic gets paid, but it might not be 100% by the client. So would love for you to read the blog and learn about it. And please spread the word about Open Door. And next, this is what we get a lot as we travel around the country. People say, Dr. Pisano, you don't understand. We have a lot of cats outside here, and especially when we go to the South. But guess what? Turns out there's lots of cats in New York and Canada and everywhere else that like to be outside. So Dr. Hurley and Dr. Levy published this article, the references in the slide at the end, but this just shows you this blue is unowned free roaming cats, 55 million in the United States, 26 million pet cats who have access to the outside. And then look at this tiny sliver, 1.6 million cats that are going into shelters and 364,000 of them who died in shelters. And most of them died, I'm going to guess, because they got sick in the shelter or perhaps they were unsocialized. But when you look at this pie chart, you realize that taking them into the shelter isn't really a major change in this pie, right? So we have to think, remember our microcosm, and this is one thing that, boy, I thought this whole thing was absolutely insane, what I'm about to tell you, but now it's the norm and I'm the biggest preacher. And so here we go. This is about not only trap, neuter, return, but shelter, neuter, return. And that means that cats, all those cats that people let in and out, about 40% of cat owners and all those cats that prefer to be outside, if they get picked up and go to the shelter, less than 2% will be reunited by their families. So my question is, if you were doing something and paying for something and had this giant program that failed 98% of the time, would you change it? Of course you would. So we have to say, we have to do something different. We have to stop telling the public to bring cats to the shelter because they're lost. First of all, cats don't get lost. All you cat people know, cats are smarter than people and they simply don't get lost. In fact, they're 7 to 13 times more likely to find their way home from a street than a shelter. So having this information, our recommendation is to not take them in the shelter and they go straight to spay neuter and they go back where they were already cared for. How do I know they're cared for? Because they have a healthy body weight, healthy body coat. This is something I did not believe in this program when Cameron started it in 2008. And then I had an epiphany and I saw this cat that was 10 or 12 pounds look at me and say, do I look like I'm suffering? Do I look like I'm starving? Of course not. You're a healthy cat. So all I need to do is stop you from reproducing, vaccinate you against rabies. So it's called the superhighway for cats. So we put them right back in their original location. Turns out research showed less than 1% were too sick or ill or injured. So every once in a while, yes, you're going to have to euthanize one for that. If you have, and some of them that are going to come in, you're going to, for whatever reason, you can't put them back, then maybe you would put them up for adoption, but you're not going to typically put up a friendly cat for adoption in the name of, I'm going to get them a better home, because 40% of the time, the new adopter is going to let them outside and you just created another cycle of waste when they already had a home. Concentrate on cats who need your help. And then of course we have working cat pathways, etc. For kittens, this is really important too. We want to keep them out of the shelter because it's the most dangerous place for them, where they're exposed to infectious diseases. But there's a little asterisk there. Maybe they would go up for adoption if maybe you have adoption events. Maybe you're getting them adopted in one single day. Maybe you're turning them over super fast. So maybe you would put them in your adoption area. What if you have pan-luke? What if you have lots of URI? What if you're really overcrowded? Then you want to, if you have another pathway like foster to adopt, put them in foster as their pathway to adopt, go ahead and do that. But do everything you can to keep them out of the shelter. This program and what I'm talking about benefits not just the cats. First of all, it decreases the number of cats that are going to negatively interact with people. We now have more resources for dogs because this is 80% of the cats going into shelters are in this category, in the stray category, which is fake stray, right? And it decreases the impact on wildlife as we again reduce the number of cats that are being born in that neighborhood. It really is the fiscally responsible thing to do, and it provides sustainable solutions for those constituents who are complaining, like they don't want the cat spraying in their front door. Neither do I, and I'm a crazy cat person. So that's understandable. So here's what happened in El Paso. You can see here, the blue, remember, is euthanasia. Look at those trends when they started doing community cat programs. And it was, I think, around, Cameron will probably remind me, I think it was 2015, this big jump here, but decrease in the blue, which is euthanasia, and increase in the green, which is live outcome. And then we do have theirs up to 2021. So look, they didn't even go, they're not even back to 2019 numbers. So that's really good news. In Greenville, South Carolina, they started the program here. So you can see the immediate jump. 2,000 less cats went into the shelter and 2,000 less euthanasias. And this was budget neutral. Now, I will tell you, Greenville does have a spay neuter clinic on their county shelter property. And so the cats, instead of going in the shelter, went to that spay neuter program. And 50% of those people that brought in the cats said, sure, I'll pick them up the day after surgery and put them back. And then that wasn't the end of it. Look, once again, it decreased again by 1,000, not just euthanasia, but intake. And when we were there, it was a sad state of affairs and lots of URI and no portals. And when I was there for a wedding a couple of years ago, this little guy had just come in. He's there in his portalized cage. He probably is going to be there 24 hours and out the door. Nashville, you can see the same trends as El Paso, increased live release, decreased numbers of euthanasia, and overall reflection of intake, even though, like I said, this is just the outcome part, but this is a reflection of intake. Here, I think, is the most remarkable story. Danville, Boyle County Humane Society in Kentucky. I started working with them back here in 2018. They took in over 1,200 cats. They're a nonprofit, but the county does enforcement and owns the building and does animal control and was bringing in cats by the truckloads. Let's fast forward to 2021 when they brought in 19 cats. They went from 1,200 cats in the shelter to 19 cats in the shelter. But look instead what happened. They helped 1,000 cats through other means by supportive self-homing, home to home, community cat programs, Good Samaritan foster care, all of those things. So this just proves, and we have lots of shelters with great numbers, but this one is crazy, but it just proves that you can do this, that this is possible when we engage our communities and we get out of our own microcosm, when we get out of our own heads. So this is a webinar here, the link is here, that we did with the Million Cat Challenge. That's a really chock full of all the great research. And then this link to this article is the March 2022 article that Dr. Levy and Hurley wrote that I had referred to, and that's also at the end. So you have some great resources there. If you're thinking that this is crazy, what I'm talking about, or you think, boy, I need to have that language, I need to have more data. So as I try to influence people and let them know that this is a program that works, that I'll have the tools to do that. So again, coordinated triage intake, sometimes it's called managed intake or managed admission. We like to have lots of different titles for the same program, but I wanted to mention and have a reminder in here about Memphis, Tennessee Animal Services, another public shelter. That director, Alexis Pugh, said, you know what, it costs us $309 just to take an animal into the shelter. And so you know what? If somebody needs help and it costs up to $300, we're going to help them. And that's what they did. So they help more people and pets in a way other than shelter intake. and their shelter intake has decreased. In Asheville, at Asheville Humane Society last year, I think it was in 2020, is they helped for the first time, they helped more animals in the community than they took into the shelter. So that's the transition that we want to see. And so it's not about turning animals away. It's not about saying we're full or we can't help you or we can't take you. It's we're not going to take them into the shelter because that's not in their best interest. Let's work on some other alternatives and let's see how we can help you. And then at the end of the day, we might have to take you into the shelter, but let's try these other alternatives first, because we know you love your pet and we know that there's other alternatives that we can help you with and empower you and give you these opportunities. So that's better for the pets and better for you. So this was a study that was very humbling to me, because I judged people who were leaving their pets in shelters. And I thought, give them to me because you don't care. And I just want to have those pets. And no questions asked. And that's how we operated in animal welfare for decades and decades, up until, thankfully, several years ago. So in 2015, the study came out by the ASPCA that showed up to 80% of the pet owners did not want to surrender. They just needed temporary help. And that was very humbling for me, and heartbreaking at the same time, because all this time I was judging them instead of saying, what can I do to help you keep or place your pet? And remember that saying, well, they shouldn't have pets. Well, guess what? 29 million people who own pets are on government assistance. So let's try to help them have the best lives that they possibly can. And being in a shelter is not fun for them, and it's not always a positive experience. In Brevard County at the sheriff's office, they thought this was crazy, and they tried it. They were like, yeah, whatever, we'll try it, and we're sure it's not going to work here. But look what happened, with no impact for budget or staff, not increasing the number of staff. They decreased owner surrenders by 80%. Year one, guess what? Year two, same thing happened, 80%. Every year of the first 4 years, we're now in year 5, they help 80% of the owner surrenders in ways other than shelter intake. So Home to Home, if you haven't heard about it, is one of those supportive self-homing systems. It is a great resource, and we encourage everybody. And I think we recommend the Rochester Animal Services website to a lot of people, because this section about supportive self-homing is so complete and so great, with all these different options. And dogs on deployment is, and I'm not sure, there's some communities I know that don't have dogs on deployment, but I put that in there to remind myself to tell you, there's other organizations that might be working with different groups of people that you can work with in your organization who might need some support so that they don't have to surrender. But lots of great opportunities online that we can take advantage of and help people. In Jacksonville at the city shelter, what happened was they transitioned. They were euthanizing many animals for space, but years ago they said, we want to end euthanasia for space, and they were on the brink. They were overcrowded at the time, and they said to their community, please help us foster, adopt. So the same 2 foster coordinators who had sent 456 fosters in 1 year out, the next year sent 3,774 fosters out, the same 2 people. So it just goes to show you, organization, capitalizing on technology are super important to organize these programs. The other secret in Jacksonville, they have an amazing live outcome program. So those animals didn't get stuck in foster. They go from foster to adopt, their adoptive homes, or maybe those are foster to adopt homes. And then of course, don't kidnap the kittens. This is super important. We all, people who care about kittens and puppies, but kittens especially, those mama cats have the kittens, they go get something to eat, and then people panic that they have to save the kittens. They bring them to the shelter, and for eternity, we have said, no problem, we'll take them in. But we never told people that we didn't have endless bottle feeders to save the kittens. So this is a great webinar or a great video you can watch, Leave Them Be, it's called, from Pasco County, Florida. It's a great 5-minute webinar or video. And then kittenlady.org has so much great information. There's actually a handout. So if you're an organization and you don't have this handout on your website, please go check it out now, because it shows pictures. These kittens, these neonates need help. Get them out and, get them assistance. And these kittens are healthy. You don't need to intervene. This is the most important thing you can teach your community, because they can leave those kittens where their moms are already taking care of them. So the next level is, now that, we have thought about everything that we could do to look and exhaust alternatives to intake. If animals do have to come into the shelter, how can I get them out of the shelter in the shortest length of stay possible? And I already told you how impressed we are with the length of stay at the city shelter, 7 to 8 days, amazing. So we need to look at, what are we doing? Convenient hours, posting them immediately on intake, making sure the public can see them, going to the ends of the earth to try to reunite those pets with their families, dogs anyway, because cats, that TNR, SNR is the way to return them. So we need to have, this is advocacy plan of action to the shortest length of stay. That's LOS, is length of stay. And then if they do come in the shelter, we want it to be like summer camp, right? So we want it to be a fear-free environment. We want animals to have enough space, the appropriate housing, nice place to rest, all of those things. And they want human contact. And it's really, really boring to be in a shelter. So interactive kennel enrichment, toys and things like that is super important. For dogs, nothing compares with play groups. Play groups have shown to not only decrease length of stay, but actually research has shown that if they decrease the stress hormone cortisol in the dogs, they decrease reactivity. So other dog, barrier reactivity is a big problem in shelters. So I was so impressed with Rochester Animal Services working with Kodak, and thanks to Kodak for providing those play yards that are a block away, and the staff and volunteers do such an amazing job. Lollipop has the most beautiful campus, and so they're working on getting their play yards all set up. And actually if I think Alex is here, if you want to put in the chat if your play groups have started yet, or if you know when they're going to start. We're so excited to know that that's going to happen. It's a game changer for dogs. It really is. And therefore for staff, and therefore for the entire organization. And then of course, it's the medical care and surveillance. Are we catching, infectious diseases are always a challenge in our shelters. Even the best shelter, it's just like having kids in a daycare. So are we catching things early and addressing them, treating them, etc.? And this is all tied in to fear-free, to housing, to play, to decreasing stress, etc. And obviously the short length of stay, and I'll say it again and I'll say it forever, but the best way to keep them healthy is keep them out of the shelter. Now, spay neuter of shelter pets is a total given. So we all agree, of course we want them spayed and neutered before they leave the shelter if they're large enough. Of course we do. Well, guess what? Spay neuter capacity in shelters right now is also a crisis. And so all of us at the national level, whether it's HUS or Best Friends or Team Shelter, we're all saying the same thing. Do not hold them in the shelter to wait for the spay neuter. Send them to their adoptive home. They can go as a foster, or send them to a foster if they're still intact, what have you, just so that they don't have to stay in the shelter. And when there's when transport groups a lot of times the receiving shelters don't mind if they come in intact, but in any event, we don't want them to stay in a shelter just to wait for the spay neuter. And we hate saying it, we hate recommending it, but it's not the end of the world. We have to think about the risks, and it's better for the pets to get out sooner than later. Here's a biggie. But I shared with you that I was really judgmental about people leaving their pets in shelters. I was equally as judgmental about adopters. And I thought, boy, I better charge a high adoption fee to make sure that this is a really serious adopter, not correlated. So please, please, please read Adopters Welcome. If you haven't already, you can read it for free online. The link is in the last page of this presentation. It was an eye-opener. It changed my perception about adoptions. It truly did. And I think this is the most important resource in all of animal welfare. And I think anybody who is doing adoptions must read it. So please, please, you could do it for free. You can get a hard copy. I think now it's like $15. But Cameron she had her nonprofit rescue for a lot of years, doing very, very closed judgmental adoptions, and she didn't adopt out a lot of cats. So last year, just by herself she's a volunteer, as is her friend. She doesn't have a shelter. In one cage in 11 pet supermarket stores, Cameron did over 1,200 cat adoptions. Okay, so you have the expert there in cat adoptions on this call, and her story is Lucky Cat Adoptions. It's also profiled in the playbook. And I'm almost done, which will leave us some time for questions. Rescue, transport, all of those great partnerships that we need to have. Again, we want to be as efficient as possible and have open communication, first come, first serve, in the interest of and when I say first come, first serve, I mean adoptions or rescue, just in the interest of short length of stay. And then if you're not aware of these technological resources, Dubert's Foster Space is a great one, and Maddie's Pet Assistant, so you can check that out. But thank you so much for listening. I want to thank Maddie's again for sponsoring the consults for the shelters, Lollipop and Rochester Animal Services. The playbook's available on Amazon. And this is my dog Potato. I'm not a foster failure. I'm a successful adopter. That's on her. That's her adoption party picture. And then these are all those websites I was talking about during the presentation. And I am going to ask Chris or Cameron, if you're still on, to let me know about any questions.
Hey, Sarah, we do have a question from Alex. He was curious if you'd had a chance to read up on Winograd's write-up and if you have a response. And
Alex, I actually have not. So Alex, tell me about that. Is it a recent one, just in the last couple of months? No, the answer is no, I haven't, but I would like to know what you're talking about.
And Alex did share the link, so I can forward that to you, but of course, you won't be able to respond on the spot, but maybe you could get back to Alex.
Sure, yep, I will, absolutely.
So the other part of Alex's question was directed at animal services and specifically related to like the negative criticisms associated with implementing human animal support services here in Rochester. And he's shared with us a snippet from a post from Habitat for Cats, which is one of our local TNR cat organizations in Rochester,
okay,
from 2016, where they were a supporter, and then a recent post where they're clearly not. So he's basically asking, us to elaborate on, or maybe talk about why there's this criticism. So let me say, I guess, share my thoughts, and then maybe you can comment. But I guess in a nutshell, I can't really say, I can't speak for them on what the concern is. But that post that you shared is related to what Dr. Pisano presented there. We're not telling people, just put the cat back outside. We're using a triage system like was discussed in this presentation. And the outcome that's recommended may ultimately be that the cat gets returned outside. However, what they are doing, sorry, I just realized I wasn't on camera. So it depends on the circumstances of whether or not we're saying anything about the cat may be returned outside. The other part of this, though, is that at some point over the last 2 years, it seems that something that we did or I said may have triggered some some upset, and so there hasn't been any dialogue since August 2020 between me and Habitat for Cats. So I don't really know what the specifics are. But our programming has continued to evolve during that time. So what was happening early in the pandemic was a lot of shelters were saying, yeah, we actually just can't take in these animals. We have to save space because there's animals coming in from people being hospitalized. Our staff is going out sick. So shelters across the country were reducing intake to essentially the sick, injured, and menacing, public safety issues. So what we did initially and what we're doing now are different. And so it has kind of changed through a series of iterations. We didn't have an official community cat program. We weren't doing return to field, 2 years ago. We were, or even a year ago. We were essentially trying to work with community members to support those animals staying out of the shelter. And when that wasn't possible, the animal would come in, it would go into foster care, and in most cases, they would be transferred to one of our rescue partners. But I think the issue comes, some of it comes down to a difference in philosophy on what to do with friendly cats versus unsocialized cats. And so Dr. Pisano talked about that in her presentation. So that's part of it. I think some of it is the confusion over what we were doing 2 years ago and what we've been doing over the last year and what we're trying to do now. And last thing I'll say before giving the floor back to Dr. Pisano is that we're actually officially implementing a community cat program now. So where an animal comes to us through our triage process, if it's identified as being a community cat in that it's outdoor, unowned, friendly or not, friendly or feral, that it doesn't have to be an intake where it is required to be held for the mandatory holding period for a phantom owner to materialize and come for it. Instead, it would be on track for vaccination, spay, neuter, and then return to the location where it came from. So, we hadn't been doing that officially. We only sort of dabbled with it. And so now that's a recommendation that we got from Dr. Pisano. It was a plan of ours that was in the hopper, but we were exploring like how we would do it. And at this point, we still don't really know what our capacity is to be sterilizing the volume of animals that you saw on some of those graphs that Dr. Pisano shared. But we're implementing it as a new tactic to try and reduce holding cats unnecessarily for owners that don't exist to come get them, and work to stabilize the population, vaccinate the population, but not displace those animals that have an outdoor home. Do you want to add anything, Doc?
No, just I was just looking at Gail commented. I'm sorry you're upset about this, Gail, but the point is not to turn people away. It is to try to link them to resources or be the resource. So some shelters can do the surgeries on site, some can't. It's the point is not turning people away to see what kind of help. And I do realize you have a very high poverty rate in your community. Cameron, were there other questions?
No, everybody seemed to be really quiet. One thing I would like to just throw out there for you is that all of the communities that we've worked with that are implementing these programs are actually realizing that outdoor community cats do not have a shorter lifespan than any other cats. They're often just as healthy, or if not healthier, than pet cats. And Best Friends did a study with over 100,000 community cats and found the same results that we did here in Jacksonville, that less than 1% were too sick, ill, or injured to go back. And ironically, I was one of those people who cared for outdoor cats and also believed, like what the media said, that they had very short lifespans. But I can tell you, these cats are living forever. And while there are some that do, get attacked by animals or hit by cars, that's not, more are actually surviving and living really long. The cats that we saw that were part of that 1% were actually older cats that had developed cancer or just very unusual medical conditions that you wouldn't see in a young cat. So they are living long, healthy lives for the most part.
Great. And Gail also had a comment about tiny cages, and you're absolutely right. And so that's what I was alluding to in the part about housing. Number one, to help them in other ways than the shelter. But you're absolutely right. I mean, when they come into the shelter, they have to have adequate space. And for cats or dogs, it's double compartment is going to be the best for them. There's a lot of shelters now that are having dog runs for cats. So they have lots of space, free roaming rooms with 10 or 20 cats. Some cats just don't like that. And remember, we want the length of stay to be under 14 days. And it looks like most of the studies are showing that cats want to, it takes them like 3 weeks to get used to each other. So you don't want them there for 3 weeks. You want them there less. So having a variety of appropriate housing is very, very important. Absolutely.
Also, the comments that Gail made about shelters, are fairly ubiquitous throughout all shelters, regardless of the size, the funding, the government versus private. Shelters aren't great places for animals, cats in particular. And just the fact that cats can hear dogs barking, like even if everything else was magical, just the dogs barking is enough to have cortisol levels spiking, animals more susceptible to illness, or just the trauma of that. Not all cats lived with dogs or are comfortable with dogs. So I mean, just simple things like that like that's part of the thought behind why it's not about turning folks away or turning cats away. It's really taking a different look on what services we're providing, and it's this institutionalization of animals that we need to do a different model. The human animal support services model is geared towards asking the community to be part of the solution. So your community is really the center and the hub of how you're taking care of animals. And so whether it's supporting owners keeping their pets, helping owners find missing pets, or assisting owners who are struggling with keeping their pets with the rehoming process, but having them be able to hold on to it in their home until a new home is identified. And all of those things are about what's best for those people and those animals. And so that's the theory behind human animal support services. I mean, I'm interested to hear if Gail wants to follow up with me through email, since we're out of time. My email is in the chat, chris.fitzgerald@cityofrochester.gov. But happy to address, what might be misconceptions about what we're doing relative to human animal support services, or if it somehow seems like we're not adhering to the theory or the concept of it. Thanks, everybody, for being here.
Yeah, the last thing I want to add, Chris, oh, sorry.
No, go ahead.
I just want to make a last comment about that too, is that I think there have been in other communities rescue partners that are a little upset because they say, well, they didn't go into the shelter, but they came to the rescue group and then we don't have any help. So that's a valid point. So again, the funding, and I work with municipalities all over the country, we try not to link funding to the number of animals going in the shelter because we want the funding for the pets who need it. So they may or may not be in the shelter. And so if a rescue partner is having to bear a larger burden, then absolutely, like they should also be part of the plan as well. So that's understandable frustration for sure.
Okay. Cameron, I didn't see anything else. Did you? I tried to scroll back through.
I think we're good, Cameron, right? Oh, Cameron might have had to sign off. Okay, we'll call it good. Well, thank you everybody for listening. Chris, thank you so much for this opportunity. And make sure everybody thanks Maddie's.
Hashtag thanks, Maddie's.
That's right.
Awesome. Thanks, everybody. We'll see you the next time. Bye, Dr. Pisano.